Hello friends, I'm Dr. Priyata and I welcome you all on the behalf of Mission MRCOG. Congratulations on your success of Part 2 MRCOG, this being a very difficult exam. So today my job will be taking through the Part 3 MRCOG orientation, little bit about stations overview and tips and tricks to crack it. So it will be will be appearing as a lecture, but if any time you think that you need to ask, then you can stop me and I'll be answering your questions. So just let me know that I'm audible. Please write in the chat box whether my voice is clear or I'm audible. And please let me know,
Yeah,
are you okay? Thank you, Henny. And is the screen visible?
yes,
Okay. So let me start. So, the key to success for this part 3 exam is understanding what are the expectation of RCOG. Because we being a practicing gynae people, we know each and everything of this obs and gynae. But the key to success will be just understanding what RCOG wants from the candidates in every station, so that this exam can be cleared, easily passed. Okay, so let me take you through the task. What happens in the on the day of exam? So you people will be given 14 tasks, and the time for each task will be 10 plus 2 minutes. That means that there will be 14 cubicles, and outside cubicle you will be given like 2 minutes, and there will be 2 3 pages will be there in outside the studies of the cubicle. So you need to just read your task, what need to be done in 2 minutes time. Then you need to make your plan. After that, you will go inside and you will have a 10 minutes to show yourself like how you will perform inside. Well, just decide your future. So total task will be, so each task will be 10 plus 2 minutes. 10 minutes inside and 2 minutes outside cubicle, and there will be 14 tasks, and total time of this exam is 2 hours and 48 minutes. Okay, and this exam is testing knowledge at the level of ST5. So many of our people who are giving this exam, some of them are at the junior level, like they are doing their post graduation in their countries. For them, it becomes a little bit easy. But there are some people who are already working at a higher post, they are consultant at their places in the hospitals. So for them, it becomes little difficult because to pass this exam, you have to come down to the level of registrar or ST5 to pass this exam. Because if in the scenario that has been given to you is there is a demand that the call you need to inform your consultant, but if you're not able to do that, then in that situation, communication with colleague domain will be you will lack mark in that. So everyone who is giving at this exam thinks themselves that they are at the level of ST5, that are the post graduation level in our countries. So this exam is actually the whole syllabus of the RCOG has been divided in the 14 modules, and they test all modules. And for part 2 exam, the syllabus has been divided in 18, but for part 3 they are testing only 14 modules. So you will be getting each task from that will test your knowledge about that module. So how the division of modules has been. So there will be core surgical skill, post-op care, antenatal care, management of labor, management of delivery, postnatal care, maternal medicine, teaching, general gynecology, subfertility, oncology, urology, sexual and reproductive medicine, and early pregnancy. So you will be getting all 14 tasks and one task from each module. Previously in the exam, So there could be a possibility like you'll be getting two cases from fertility, or two cases from general gynae, and one part of the module is missed, or one part of teaching your task is missed. But this part 3 exam is a well organized exam, and they are testing your knowledge on each module. So you really need to do all the syllabus very well, because they will be asking from every domain of the exam, your syllabus. Okay, and another important thing, that is understanding of this exam. So marking is done according to the domains. Like the whole, they will be testing 5 domains, and those domains will be in the form of a patient. They will be checking your patient safety, information gathering, applied knowledge, communication with patient, and communication with the colleague. So for each domain, the marks, they minimum mark is 0 and maximum mark is 2. So they have they, whatever they are doing is the closed marking. Okay, so if the person uh, is not able to pass, so he will get score of 0. And if he's like, if they for in the patient safety, in any task, they have just made 10 points. Okay, if you are able to just explain, put in the answer of your station 8 out of 10, then you will get 2 in the patient safety. But if you are if you in your answer it covers only 5 to 6 points of patient safety, you will be getting borderline, that is the mark will be 1. And if it is less than 5 points you are covering patient safety domain, then you will be getting like, the candidate will be getting 0. So this is a closed marking system. So it is really difficult even marking a candidate, because it is very difficult to judge that how many points they have literally covered. So what the RCOG says, when you go into the station outside, you start with a 0, then with your performance you gain your marks, and then you just pass this exam. So it is not like every station will be having 20 marks or 30 marks, or whatever points you are saying, they will be just giving marks on that. So it is, the marking system is not like that. It is the domains. So you have to pass domain. So maximum in whole of the exam, the maximum domain that they will be testing will be 70. That means in one task, they will be testing, like role player tasks are there, where there are two examiners. So total number of a domain will be tested 7. So it will carry like 14 marks in total. And like in your case based discussion task, so there will be 3 more domains will be tested, or 4 will be tested. So marks will be assigned to those. The task will be like either 6 or 8. So this is the understanding that this is domain based exam. They are marking on the basis of domain. So whenever you are preparing, you have to just your study partner has to give feedback to you on the basis of domains. Then you will just develop a habit of just doing station according to domains. And that is a requirement of RCOG. Okay, and whenever you are going inside the cubicle, whenever you are reading your task, it is must that you should read what domain they are testing in those station. If you are able to cover that domain, then only you will get passing mark in that station. So this is domain based exam. Okay, and now let me come to the type of task. So the type of task is usually, these are, you will find it written in the outside of the standees: stimulated patient task. So if it is simulated patient task is there, that means you are doing role play station. And if the second type of station will be simulated colleague task, that means you are dealing with your colleague. So it is very important to read whether it is a simulated patient task or simulated colleague task, because candidates do make mistake that they are in a hurry or in a stress, so they do a simulated patient task as a colleague task. That means many of the people has done this mistake. Role player station, they didn't read it, and they think that junior colleague is sitting there, and they did it like that, and the vice versa had happened. So it is very important to read that what type of task it is there. Third, it is a linked task. So this is the new thing that has been introduced in the part 3, is a linked task. That means like there will be two tasks and they will be linked. Let me give you example. Like in one task number 6 can be a patient has come and she has a breech baby, and she wants to discuss her options, and she has opted for like going for elective section. So task number 7 will be your linked task, and that task will be like you need to take consent for the cesarean section. So these type of tasks, when you are seeing same patient on the two stations simultaneously, these are the linked tasks. And this link task, so the marking of if you have performed like badly in first station, then it does will not affect your marking in the link task or the second task. But what will be the difference if you are getting same patient? Then in that condition, you will already know the name of patient, age, what is the name of patient, what is the age of patient, or what was the like in the history taking or information you have already gathered. So that part you won't be it will not be required in this station, because you are seeing same patient for the second time. So at least one link task you will get in your exam. Last will be, the fourth type of tasks are the case-based discussion. These are the viva station. The only you will be there, and you will find that one examiner who is a clinical examiner or a doctor is sitting and taking your viva. So these case-based discussions are like totally testing your applied knowledge. Though this is the communication exam testing on your communication skills, but case-based discussion test much on your applied knowledge part, that is your knowledge part. So these stations are full of knowledge. Okay. Then type of examiners. So you'll be getting two type of examiner: clinical examiner like doctors, and the lay examiners will be there. So what are these lay examiner? These lay examiners are the people who they have taken from the community. They can be teachers, they can be lawyers, or for example, if the endometriosis station is there, then they do have a support groups, as we already know. So there will be a person from the endometriosis pain society. If the vulva patient station is there, then they do have a vulval pain society. So lay examiner can be one from the vulval pain society. So these are the lay examiners, and they test the domain they have to test will be like communication with patient, and patient safety part, and and your communication with colleague. Like all these three domains, they will be testing this, because they have no idea about information gathering domain and the applied knowledge part domain. So they will be checking on your other domains. Okay. So so you will be getting minimum 4 or 5 tasks, where you will be getting this two examiners, and these will be the role player stations, and like they will carry maximum marks. So you have to be very careful and do very well in the role player stations, where you will find two examiners. Then as I already said, to pass this exam, it is important to know key to success is to understanding what they want. So there are certain points that are covered in each domain, and those points you have to like cover in that station to gain marks. So the patient safety is like utmost priority. So if you are able to do very well, and all 4 domains are passed, and your aggregate mark is more than like passing mark, but you are lacking somewhere on the patient safety, then it will be very hard to get through this exam. So it is must to do well, and to pass this patient safety domain, because and patient safety will be tested, it is the only one domain that will be tested in all stations. So the understanding of this patient safety part is very important, because NHS is looking for the safe doctor, so that there will be less patient safety accidents, and there will be less number of cases for the litigations. So this is the understanding that the patient safety is very, very, very important. Okay, so what are let me explain you what are the points that are covered in the patient safety. Okay, so important points are uh, that are covered in the patient safety will be whenever patient safety and patient dignity, whatever are the beliefs of the patient, and that you have to respect. So this is the requirement of the GMC, that the patient safety and dignity of the patient has to be maintained. Call for help. That means you should understand what are your limitations, and on the this and with your limitations you will be doing work. Like if you are working on the ST level of ST5, and if there is a patient that requires your consultant, then in that case you have to call your consultant. And like if you're dealing with a gynae emergency, or you are dealing with the obstetric emergency, then there major emphasis will be on the call for help. So this call for help is a very important part, and because you have to know your limitations. And so this will be after that this will be confidentiality. Maintenance of confidentiality is really is must, because in many of the station this part will be tested. So sometime there will be and you will get some another patient, and they want to ask, like if there had been some you have got a patient with a rupture ectopic, and someone from her family has come and they want to ask about the patient, then in those stations you won't be able to say anything, because that will be the breach of confidentiality. And so this is one example. Another example, like if you need to gather any information from the patient notes, or if you have to see patient notes, then you have to take permission. And all the time while making patient records, or while electronic images, the confidentiality of the patient has to be maintained. And this will be tested like in one or two stations. There will be confidential stations. Another will be the duty of candor. So this will be requirement for duty of in like some complication has happened. Like there had been some operation, or such there had been some complications, like if there had been, for example, bowel injury, bladder injury, after, or there had been any VTE station is there after post-op, then all complication stations are there. After that, when you are debriefing those patients, you have to show your duty of candor. And what are the principles of this duty of candor is, like you have to, the doctor has to be open and honest. Whatever the condition has happened, whatever the situation has happened, you have to give this patient an factual explanation in the chronology, that what had happened, what was the incident happened, and what was her condition at that time, what people you have called for help, and how the management was done, and what will be the implication of that particular complication that had happened on her. Like what her implication could be, like short-term implication, her hospital stay will increase, or it could be long-term implication, like if there had been that will depend what type of complication had happened, and you have to arrange for follow-up. And that will be with the general practitioner, with your unit or your consultant or your team. And another will be like going for an internal investigation. That means that there will be an incident reporting. So to find out if there had been anywhere there had been a lack of care, to look for the to make the say avoid this happening again in the future, and to make the safe environment or safe surgeries. So these are the five things that are covered in the duty of candor. So they are testing your knowledge about duty of candor, mostly in the complication stations. So you have to everything, like and you need to cover all five things. You have to be open and honest, giving complete and chronological factual explanation, explaining them implication follow, and the explaining about in the incident reporting. Then another will be another part that is important in the patient safety will be undermining your colleague. So many times you will be find that there had been a station where they have shown that midwife has done it, and the role player will ask you, okay, that midwife was incompetent or your junior colleague was incompetent. Therefore, I have been going through the situation. So in those stations, you have to just cool down the situation and explaining that all people working hard, the competencies are signed off. Like you cannot undermine your colleague. You have to always protect your colleague. So there will be some task where they will be checking your knowledge on undermining of the colleague. Then mental capacity assessment. This is also a very important part, because sometimes they will be testing your knowledge on the patient mental capacity assessment act. They will be giving you some scenario where either the patient is not mentally competent, so either her sister is coming, or her daughter is coming to ask about her question, take knowledge about her. In that situation, you have to just find out that what is the situation, and whether the really patient mentally assess mental capacity is impaired. And there is a different technique to do that type of station. But if that station type of station is there, then the technique of doing that will be in a different manner. Another part that is checked in the safety is the Fraser competency guidelines. You will be getting some younger girls, like less than 16 years of age. Those station will be checking your knowledge about Fraser competency guidelines, and what are these five guidelines are there. You have to just show the application of those guidelines in those a type of station. The most common that comes type of station comes that will check your Fraser competency guidelines will be like under 16 years girl, they are coming for emergency contraception, or they are coming for termination of pregnancy. Then involving chaperones. So these chaperones, these are like healthcare assistants. So whenever you are examining any patient, so you have to make it sure that the chaperones are there, and it carries like important marks in the patient safety. Another point that is important in the patient safety is respecting cultural and religious belief, because whatever you cannot impose your decision on any patient if they have some cultural reservations or religious reservation. We really need to respect them. So most common example of this will be if the patient is, if in any station you have to offer blood transfusion to a patient, then in that asking about Jehovah's Witness will be very important. So that will be cultural, in respecting their cultural and religious beliefs. Then another part will be in patient safety domain. If the antenatal care, they are checking on antenatal care module or the maternal medicine module, is that identification of the high risk pregnancy. So if you are getting the pregnancy is high risk, you have to put that word in the station and say, okay, there had been a risk, or the risk to your pregnancy, and according to that management will change. And also you have to identify whether the patient is taking smoking and alcohol and drug. So if this type of problem is there, then you have to counsel accordingly that what will be the effect of smoking, alcohol and drug on their health or on their pregnancy, and you have to offer them proper support. And identification of domestic violence is very important, because all these domestic violence station, they come with a hidden agenda. So you really need to find out whether there had been element of it. So you may get gynae patient as a domestic violence patient, or you can get usually these are the antenatal stations. They come as a domestic violence station. And it is also considered to be patient safety if there had been any child abuse issues are there in any station, or identification of sexual assault or the rape. is important. And there is a different way to do that type of stations. So even identification of all these things in high risk pregnancy, domestic violence, smoking, alcohol, and drugs, and identification of this sexual assault, adult sexual assault, and child abuse. This will be really important, and this will gain. If you are able to identify it, then you will be gaining your marks on the patient safety domain. Then another part will be there, like if you're taking, that will be checked in your pre-op rounds, or in your post-op rounds, or in your surgical core surgical skill domain module, that whenever you are taking to your patient to theater, then you this checking for WHO safety checklist is really important, and that will that will again consider as a mark for the patient safety. So if like this in core surgical skill domain. Okay, so whenever you are going for taking your patient to theaters, checking using the word W, checking for WHO safety checklist will be like must, and that will give you marks on the patient safety. Checking for allergies is must, and you need to show your knowledge of this checking allergy in all of 14 stations. Checking for blood group in antenatal stations will be must, because if the patient is bleeding, you need to give them anti-D injections. Checking even checking for pregnancy before intrauterine procedures is important. That will be checking for patient safety safety issue. Like if you are taking a patient for hysterosalpingography, then you need to make it sure that she's not already pregnant. So such type of stations will be there, whether you need to show that your knowledge that you will check for pregnancy. Okay, and now many of the stations will come where you need to just explain them about the medication. So it is not just you will take explain that you need to take this medication to the role player. You have to, before giving any medication, you have to rule out all of the contraindication. So this will come on the patient safety, because if many times you will get a task that the treatment part, in the treatment part answer will be giving metronidazole, and in the information gathering domain you will find that this patient is allergic to that. Okay, so whenever you are prescribing any medication, please check on contraindication, explain role player mechanism of action, how it works, explain them how to take it, route, dose, and and what will be the side effects, and also giving them safety netting advice. Then when she has to come, if you are prescribing on some medication, so whenever any station come and they that checks your knowledge of medicine, so you have to explain them everything. And also whenever you are prescribing, you have to take this BMI part in the picture, and make it sure that they are already not taking any inducers, to avoid their head for any enzyme inducer interactions. Many times you will see this part role player will be hiding from you. They will be taking some inducer, like most common they will be taking the St. John's wort, and you now in applied knowledge part, you have to prescribe this oral contraceptive pills. So you have to make it sure that she's not taking any, so there will be interaction, and that will if you're not able to identify that, then that will hamper your mark on the patient safety domain. Now, another thing is, whenever you are getting an antenatal care domain patient, the patient is pregnant and you want to prescribe some medication. So apart from explaining everything what I already explained about before prescribing medication, you have to explain them that, okay, this medication is safe in pregnancy. So say, and when if the this patient is postnatal patient and you want to prescribe any medication and she is breastfeeding, you have to make it sure that you have to say this to the role player, that this medication is safe while we are offering you in the breastfeeding. So this type of words will be like reassuring to them, and you need to check on their safety. Another part will be like going for prioritization. So this is the important thing that this part 3 exam is testing. So prioritization will be tested in two. of things that will be either it will be you can get in two ways. It will be either gynae list, and you need to now prioritize them, and you will again get labor ward prioritization, and this is like a very favorite station for this part 3 exam. So prioritization, according to the priority, the patient task has to be done, and the team working, taking leadership skills, all this part will be testing in the prioritization stations. Second is the finding out which patient you have to refer them early, because all the cancer patient, they will you will put them in the 2 week week pathway. Okay, then there is testing knowledge of the junior colleague by the work based assessment, and identification of the safeguarding. In many of the stations, you will be finding that the adult patient or the female patient is at risk. So you have to make arrangements, and you have to just gather them, give them support in form of adult safeguarding, and similar thing you will find in the child safeguarding. So in the role player, if you are able to identify the need of this adult or child safeguarding, and if you are able to offer them to the role player, then and that will give you mark in the patient safety domain. Now, risk management part. So you can get in this part 3 exam. There can be a separate station for the risk management. Okay, so and or sometime you will find in all of the station 14 station, they are taking checking your knowledge on the risk management part. So in what way they will be checking? Like if in the station there is requirement of any protocol, any audit, or there could be some reflective practice note they want to listen in the that station. Like in the complication station, you have to put this reflective practice in the picture. And also in some of the station there had been an incident, and you need to report that incident, so they will check your knowledge on incident reporting. And just there will be a complete station you may get, and you have to do the root cause analysis for that station. So this will be total risk management station. Reading about risk management and the is must, and that is you need to really identify where the risk is there in your station and how you will manage that risk, because it will be tested in all 14 stations. Unless you have got a full knowledge that how to find out what is the risk part and how to manage that, unless you are able to do it, you will like your mark on the this information, this patient safety domain. So this is the all about patient safety. So what till now, whatever the points I have discussed, if you are able to put all of these points according to demand of your station, then you will be able to get complete 2 out of 2 marks in the patient safety domain. Now I'll be moving to another domain, second domain. If any one of you have got any question with regards to patient safety domain, can ask me now. Any question should I go ahead? No, okay. So if you people have no questions about patient safety domain, then I am moving ahead. And one of my advice will be for all of you people that make a list of what are the points it is required in your patient safety domain. So make a list of that. Whenever you practice stations with your friends, or with if you're practicing it with anyone, please make it sure that whether you have covered patient safety or not, because this is the utmost priority, and you have to pass this domain. Without passing this domain, it is very difficult to like get through. Now this our next domain. So this I have explained now about one domain. I'm moving to the second domain, that is the communication with patient and families. So this will be another domain. Communication to patients and family. So like this will be most commonly tested in this role player stations. So you have to, so whenever you are entering the station, you need to introduce yourself. So what will be come in your introduction? You need to tell your name, what is your role. Sometime you will find in some station you are ST1, ST2, some stations you will be ST5, in some stations you will be like consultant. So you that whenever you are reading your task, you have to find out that what is your job title, at what level you are performing that station, because sometimes you are consultant in the station, and again you may do that as a role, ST5. Okay, so they uh, finding out what is the requirement of this station of your job title is really important. That is a self introduction. Then confirmation of their name and age. So this is important part of the patient safety and also communication with the patient, because you have to confirm their name and age. Confirmation of identity is must whenever you are starting the station. And again, when they have given some reports to you, like you have to explain this blood report, or you have to explain scan report, or in that conditions also you have to recheck patient name and age on those reports. So this patient identity checking is must, and that this is requirement of all stations. Fine, purposely you will find that they have given name of the patient, and many of the stations you will find that they have not mentioned the age of the role player. So in those stations, you will get special marks if you are able to check if you are able to check their age. Because the management of any illness, it changes with age, that's we know that this thing. Then making a repo making is must, because unless you are able to make a repo and feel that role player comfortable, you won't be able to continue with the station. If she is offended and if you have not make a repo, then discussion of the discuss the investigation. Sometimes you will get in the your task that you have to discuss some particular investigation. Whenever you are discussing any investigation, you have to just explain them in a very in simple language and in a very clear way. Even you can make diagrams so that role player is able to understand that what type of investigation you are saying. And then discussion of the treatment. So whenever you are discussing the treatment, you have to make like a shared decision. So this is different practice in our countries where we are doing practice locally, and this in UK. In all other part of the countries of world, actually patient doctor it do the prescription, and doctor decides the patient for treatment for the patient. But in UK it is not like that, it is shared decision. So that what is the shared decision? So this shared decision will be like what are the options of her treatment. You have to explain her everything from top to bottom, like coming from lifestyle, coming from medication, surgery, everything. Then you have to you need to inform them, then you need to engage them. That means you have to keep them engaging in your conversation. And then you need with explaining risk and benefits, you need to negotiate the plan with them. So what type of plan they want. So it is not a decision for treatment that has been done by you, it is the decision, it is shared decision. You will be giving them information, you will be keep them engaging, and with the negotiation, that a plan of management will come, that will be shared decision. Okay. And another communication, you will what you have to do in case of the crisis. So they will be checking your knowledge with patient, communication in patient and their families. Like if there had been a IUD patient, or if there had been a stillbirth, so this type of station like very common. So some either you need to do break the news of it, that will it can come as a breaking bad news station, or it can come as a like a second day. A patient has a IUD delivered and you need to counsel on second day, or sixth day, six after 6 weeks they can come with the report to collect the reports of post-mortem. So all these stations, they are empathy station. They are checking your knowledge, that how you are communicating with the patient, because knowledge part, like, they know you have, but these are totally empathy and communication station, again explaining them about fetal distress, then explaining them about collapse, like if the patient has come and something had gone wrong and she has collapsed, and you have to explain them to to their relatives. So this will be like communication with family. Again, breaking bad news, it could be of breaking bad news of cancer, or you need to break the news of rupture topic. So these are the way of communication all in all these emergency and the crisis is different. And so if you get this type of stations, then the marks, or you will be checking your knowledge or your skills, communication skills with the patient and the families. So whenever you read a leaflet, always you see towards the end, all leaflet have got this. This is the shared decision making. So what is the shared decision making? Well, so what are her options? Explain them pros and cons of each options, then support them. That means negotiate them or support them to help the decision, whatever the decision has been made, that treatment is right for them or not. So these are these are the expectation of this role player in the shared decision making, and you people really need to show your knowledge about shared decision making in the role player stations. Then, though this being a very important domain, but what really happens so the people are not getting marks in this domain? It will be like there are certain pitfalls. So many times it happens that when candidates, they are in a stress, anxiety, and tension, many times they don't introduce themselves. They just start the station, and without giving their introduction, without explaining their name and job title. So this is one pitfall. Second, making assumptions. So without even, sometimes it happens that they have not given that knowledge in the information in the station, and you yourself are starting, when the candidates start themselves, they start making assumptions. Okay, she must be taking alcohol. Okay, she must be taking smoking, or this type of assumptions if you make, then you will just miss on some important information from the role player. Then sometimes feeling embarrassed about asking question of the lifestyle, because the smoking, alcohol, drugs, so these are not very common in other parts of in other countries. We people really don't have a habit of asking this question. So if you are so some overseas candidate, they find it difficult to ask all these type of questions. So if you are like being embarrassed asking these questions, so this is the time when the lay examiner is looking at your face. So whether you what type of expression you are having on your face, so they will be just checking on it. Like if some same sex couple is there, once you able to know whether this station is a same sex station, so how you are taking that station, what is your expression at that moment, it will be checked by a role player. So this is again another like pitfall, not gaining marks in the communication with colleagues, communication with patient and family stations. Then telling treatment, like I before I said, we cannot in this exam we cannot tell their treatment. Okay, so you have got this problem and this is treatment for you. This is not the type you need to do these stations. You have to negotiate them, like I already explained. You have to give them options, you have to explain them pros and cons of the option, then together the doctor and the patient will come up with a plan. That will be the shared decision making. Okay, so this is again pitfall, because we do have a habit of just telling treatment to our patients. So this is a different thing in this exam. Then not listening. Sometimes what happens in the exam, the role player is trying to give you some hints or some cues, and if you're not ignoring them, you're not listening them, then you will be missing on an important part of information. This is another pitfall, and not responding to their beliefs. Like if they want something and you're not respecting their, or there had been an argument about something, then it is really not considered good, and that will be taken negative. That will be giving negative marks instead of giving any good marks. And very important thing. So we as a doctor has a habit of using too many medical words. So always we use medical words, and in this exam, they are checking on that. So we are not allowed in the role player stations to use any jargon or the medical word. Whatever we are medical word we are using, we have to explain in a patient friendly or simple words. Therefore these leaflets are made. So when in the initial start, whenever we start your practice, in that situation, initially people use so many jargons, but with regular practice they're able to avoid these jargons completely in the station. So ideally there should be no jargon used and in the exam. So these are the pitfalls why the people are not able to pass this domain of communication with patients and the family and the families. Like all these are the um, conditions where uh, they just lack marks. So again, you have to just make sure that you are not doing all this in the stations, and then you will be gaining good marks or complete full marks in the communication with patient and family domain. So now I will be moving to another domain. So have you got people any question with regards to this domain, communication with patient and the family? Okay, as you people having no questions, so I'm moving towards communication with colleague. So this domain appears to be very simple, and but it is the most common uh, domain to be missed in the exam, and most easy domain to get marks in the exam. Just you have to bring some communications in that station, and only by doing that you will be gaining complete 2 marks in this domain. So whenever you are doing your task or reading your task outside, just see what will be the domain marked in that station. If they have got communication with colleague mark domain, that will be marked in their in that exam in station. Then please write down on your paper that what type of communications you would require, and involve them in their station. So you will be getting mark in that domain. So what is communications? So there could be many type of communications. It could be written communication, it could be verbal communication, it could be handover. So all these are communications. So in written communication, so these are about the written communication. Sometime you would get an feedback station where your junior colleague has written something and you are about to give them feedback. So what type of things you have to explain them about the writing? Ideally it should be legible. Then complete details of patient name, date, and the patient identification details should be there. Ideally they should be signing and leaving their contact details, avoiding abbreviations. This is must, because in those stations you will find that they purposely will write some abbreviation. So they if you then give feedback that no abbreviations has to be used, writing has to be legible, patient identification detail has to be there, it will require signing and leaving your details, and avoiding abbreviations. So all this knowledge will be checked in those stations. And also this written communication stations, like you will get a consent station where a patient, you are taking the patient for cesarean section, they will give you a consent form and you have to fill along with the patient. So that will be checking your written communication. and you have to be familiar with the Data Protection Act. In many of the stations, you will find that they will be checking your knowledge of the Data Protection Act. So you have to be very careful in answering. Then another written communications, what could be there? In very long back, there had been a station that you have to write a letter to your GP. So that was a station. It can come that your junior wants to know that how the letter to be written. So writing a GP letter, writing a referral letter, writing a prescription, or discharge summary station. So all these are written communications. So you might get any of this station, so they are checking your knowledge of written communications. Now telephonic communications, these are like very important, because these days in the exam you will get in station where there had been a patient and you have to inform your consultant about that patient, and they are checking your knowledge on the handover tool, and that is a S bar. I'll be explaining that. So this is the SBAR tool, and that is a very efficient tool for the handover. So let me explain a little bit about SBAR. So this SBAR is the communication tool, and knowledge of SBAR will come like in many of the station. So it is S is situation, B is background, A is assessment, and R is the recommendation. Now what that involves? So situation. In situation, you have to identify yourself, who you are, where you are calling. You need to identify the name of patient and the reason why you are calling to your colleague or your consultant, and you have to describe your concern. So this will be the part will come in situation domain. Then another, the B will be background. You have to just give reasons why the patient was admitted, and what about medical history, if it is important, that you have to give. This background will be just explaining about background or the history part only. So this will be coming in this part. And then will be assessment that you have seen this patient. So what are the vital signs, what are your clinical impressions about that patient. Then R will be recommendation. So recommendation will be what that you can suggest something, or you have to clarify very clear that what are your expectation. So many stations you will say, okay, I would like to come you and immediately, or I would like to just arrange a referral to this patient to another hospital. So this type, what you want as a recommendation, that you have to make it very clearly. So I've explained this SBAR tool because it will be used in your pre-op round stations, and it will be used in labor ward prioritization, and sometimes telephone call station will be there. So this knowledge of SBAR income in your telephone call stations, if it is there. So and also sometime in case-based discussion, there will be a station, and patient details will be there, and they would like you. The first examiner will be, okay, so please summarize the case for me, and that summary you have to present in a SBAR pattern. So knowledge about SBAR is must for this exam. Okay, again, I have discussed SBAR, and SBAR is a handover tool only. Sorry, it was a communication tool. So again, this communication will come in the handover. Like if the labor ward is the prioritization is there, and you are just handing over to the next shift, then what all you have to involve. You have to list the tasks to be done, tasks that are awaited. Okay, so what type of tasks that you have not done and you want them to be done will be the task awaited. Leadership qualities must in this. They are checking their leadership quality in obstetric and gynae emergency stations in the labor ward, and pre-op around prioritization stations. Team working is must. because in all these type of stations, they will give you that all these are there with you, and they are working with you. So you have to involve all people, so they are checking your knowledge of team working, and also if again prioritization or the trials they are checking in this in the labor ward prioritization, or in the pre-op round, or pre-op prioritization station. So these are like favorite of our COG exams. So they would looking for a safe handover, that the all patients, all tasks has to be done in the manner of prioritization, and patient safety also, so the all patients should be safe. So this is about safe handover. Then you will find some communication that you have to bring in your station. These are nursing communications, like if you are dealing a antenatal care module patient, and the patient is diabetic, then you have to bring diabetic nurse in the picture. In like cancer stations, you have to bring this Macmillan nurses or clinical nurse specialist in this structure in your station. And if like you are doing any patient that who has got some spinal problem, or then spinal nurse you have to bring in a picture. So for everything there is a specialist nurse. Okay, so you have to bring that nurse in the communication. So these are nursing communications. And midwife communications, these are also very important. In some of the station you will find some midwives are there. So what type of midwife can be there? So it can be junior midwife, it can be some specialist midwife, and it can be some safeguarding midwife. Like in if you find that in your station that they are checking on some safeguarding issues are there, either adult safeguarding or issues are there, domestic violence is there, or the child safeguarding is there. For they have got a specialist midwife for them, and these are the safeguarding midwife. You have to bring them in a picture. And also some clinics are run by the midwife, and so there will be senior level consultant midwife. So this all type of midwife can be there in your stations. And you have to just involve them in the station, that will check your knowledge of the communication with colleague. Okay, and there will be again multidisciplinary teams. So multidisciplinary team will come in the role player station also, and in the examiner station also. So where the multidisciplinary team will come, so it can come in a maternal medicine station, when you are getting some high risky patient, and you have to explain them that what type of people will be looking after them. So it could be there in the oncology stations, and it could be there in the gynae, like general gynae station is there, and it is there. So in the endometriosis also they have MDT. So there are so many MDTs or multidisciplinary teams are there. As per the requirement of station, you have to put them in a picture. Other member that can come in your communication will be GP. It could be any if there had been any depression and anxiety, then counselor. If you are referring any patient to scan or X-ray, it will be radiologist. If there had been some appointment issues, then you will be communicating to clinical secretaries, reception peoples. And in maximum of the patient, there's some support groups are there, and involving them in your station will again give you mark on the communication on the colleague. So as I already said, this communication with colleague is the very easy domain, easiest of all to gain marks. But very frequently this part we miss in the station. So whenever you are reading station, please identify what are the domains to be tested. If the communication with colleague is there, and then please write down all communication in your 2 minutes key that you prepare before entering the station, and please involve all of this communication in your station when you are doing inside the cubicle in 10 minutes, so you will get complete 2 marks. So this is this slide I made it for my exam, because I was lacking too much on this communication with colleague domain. So I made this for me, And so I would like to share it with you people also, so that you'll be gaining mark in this domain. So if now you identify the domain, this module of the station, if the station is from fertility module, so you can, your communication will be fertility specialist. If you are referring them to IVF, it could male problem, infertility problem, you would refer them to endocrinologist or urologist. So here will come the communication. If it is the station from the urology module, then you can bring in the picture urologist. You have to refer them. Or another communication will be continent nurse if you are dealing with the incontinence station. And like if the stress incontinence station is there, then you will refer the patient to physiotherapist. So this type of communications will be there. Oncology module station will be your MDT that I have already explained. Then antenatal station, it will be if you can, communication will be to involve midwife and also to the GP. In emergency, if you are getting an emergency station, then this call for help will be your communication. In that situation, you have to explain very clearly that what member you would like to call and why you are calling them. So you have to explain them. That will give you marks. If the station is from contraception and sexual reproductive module, then please bring this sexual health clinics or this gum clinic or contraception clinic in the picture. So that will give you marks on communication. If PCOS station is there, then you need to involve bring endocrinologist in the picture. If it is menopause station there, please bring menopause specialist in the picture. And whenever you are doing any station, just make it sure whether this is a difficult station or difficult patient, you would require your consultant. So please people, don't forget to inform your consultant or have a word with your consultant or call your consultant. So this is very important because we are giving this exam is checking a knowledge of the candidate only at the level of ST5. So please always think of consultant. So in what stations you have, you will involve your consultant. And if it is, you think that is important, then please involve them. Other communication will be like counselors. I already explained, if anxiety, depression, any mental health issues there, or support groups. Almost for every station, you will find that there is a support group. So please bring them in a picture. If it is some station like a recurrent miscarriage station and some chromosomal problem is there, you need to refer to geneticist. So it could be a communication. So according to whatever the station you have been given, just find out what could be the communication and try to bring them in a picture, because it you will get complete 2 marks. Like in the information gathering domain, in the applied knowledge part, you have to do so much to gain 2 marks or complete marks. But in communication with colleague station, with only involving this colleague, you will get complete 2 marks. So if the stop smoking is required, then stop smoking services. And there's so many helplines are there, like NHS smoking helpline is there, for alcohol drink line is there, for this domestic violence, national domestic violence helpline is there. For breastfeeding also there is helpline. So for maximum stations you will find some helplines, and bringing all them in stations, you will gain marks in the communication with colleague domain. So this as I already told, that this slide I had made for my exam. So I would I'm just sharing with you so that you people get more marks in communication with colleague domain, as this is like a difficult exam, and sometime candidate only by 1 mark. So after that, bringing all aspect of the domain is important to pass this exam. So this is all about communication with colleague. If you people have got any question, can ask. Otherwise, I am moving to another domain. Any questions about communication with colleague? Okay, so I'm moving to information gathering domain. So according to the GMC, it is duty of a doctor to adequately assess the patient condition by gathering information. Information gathering is your history taking and also taking information about their symptoms. So this is the requirement of GMC, and so this information gathering. So information gathering is like very important to me, and you really need to find out that according to the station that what type of information is needed and how will you obtain that information, because there is a technique to get information from the role player, and putting the different, and whenever you are gathering information, you need to keep on just putting this differential diagnosis always in the picture. It is must in the gynae station, but in some of the off stations this differential diagnosis will come. So this is the requirement of GMC about the information gathering. And during information gathering, you need to keep on signposting. What this signposting mean, I will be explaining in the later part of this session. And there has to be holistic approach. So what is this holistic approach? Holistic approach means like if the patient is coming to you for like if the 15 years old girl, she's coming for termination or the emergency contraception. So in that station, you only will not identify, give them knowledge about, they're not testing your knowledge about contraception, emergency contraception in that station. So you have to do it holistically, like you need to find out whether there had been any safety issues, what type of circumstances this girl is living in, whether there had been any what type of relation she is having, whether somebody is not exploiting her, what is her home conditions, what are her school condition, where she is living, who is there with her to support her. So like it is total, it is not only these type of stations will not be checking your knowledge only about emergency contraception. So they will be checking, you have checking your knowledge about holistic approach. That means you have to see this patient as a whole, not only one part of the applied knowledge part for what they are coming in. So many of the station, this holistic approach will come. Another type of station that will require to show your this approach, if the patient is an IV drug abuser and they are living alone and they have got some safety issues, some money issues, some like place to stay issues, occupation issues. So all this type of station will require your help in that part only, also apart from the medical knowledge. So this is the like holistic approach and patient centered. It is not like according to the doctor they are giving treatment, it is according to the patient. And because NHS is offering all treatments are patient centered, and just whatever the treatment information you are gathering, you have to just make it sure that their social, cultural and religious beliefs should not be breached. Now, what is this signposting? So, these signposting are the phrases and the words that you would use to a patient before asking a question. So that will signpost them, or that will guide them that what type of question is coming next in the information. For example, whenever you start a station, you have to start the station with signposts. After introduction and agenda making, when you need to gather some information. So you need to do signposting. What type of signposting? So, for example, I would like to ask a couple of questions to gather information from you. Is this okay? If she says yes, after that you will start gathering information or start taking history from this patient. So this is this like signposting. Second, for another example, if the demand of the station is to ask about sexual history or to ask about sexual abuse, the signpost, what way you have to signpost, you will say, I would like to ask personal questions that may appear embarrassing and uncomfortable, but that information is important for me. After that, you can ask whatever you want to ask in the sexual history, or you can want to ask about sexual abuse. So this type of signposting is must. Without doing this type of signposting, you cannot ask question, and this is requirement for this part 3 exam. Then what will be covered in this information gathering domain? So if you have shown your knowledge of history taking, explaining investigation, or arranging investigation, or examination, so these three will come in the information gathering. So you have to do so much to gain mark in the information gathering domain, and this is the information gathering or history taking is a big trap. Unless you time it, most of the people, they keep on taking history, and whole station they will finish in the history. At the 10th minute of the station, they will just reach at the part of the applied knowledge. So this information gathering practicing is like very important to finish it within a time. Then there are certain pitfalls why candidates are not getting the mark in information gathering. Like they ask irrelevant questions because they want to gather some information and they don't know how to frame the question, and they keep on asking irrelevant question. They waste time. Second, they ask closed questions, and later I'll be explaining what are type of questions. So if you are keep on asking closed question, then that will be a pitfall, because you have to start your station with the open-ended questions. In the middle of the station, there should be probing questions, and towards the end of the station, ends of the information gathering, it is a closed question. So it is the combination of open, probing, and closed questions in the information gathering domain. If you are asking only closed question, then that is another pitfall where why the people don't get mark in the information gathering domain. Another is not listening to their answer. Role player is giving you some answer and you are not listening. It is sometimes, for example, you have asked the role player their age, and like she has said that, doctor, I'm 24 years of age, and you started with taking information, and you ask them, are you updated with your smears? So that means you are not listening to her. So because you already know at 24 years of age she is not eligible for any smear testing, so why you are asking that question? That means you have not listened when she were asking her explaining her age, or when she told her age. Then repeating question many times, the candidates are confused and they keep on repeating same question, they waste time. Then very important, sometimes it happens when the candidate is doing station, so they deviate from their task. So role player then give some clues to bring them in a task, right task, towards the right task. But if you are like ignoring those clues, then again you will just deviate from the requirement of the station, and that is again pitfall. So these are the pitfall in the information gathering domain, and it is really important to know that these are the pitfalls, because if you know the pitfalls, then if you are keep doing same type of mistakes, then you will be able to improve yourself, so that if all pitfalls are removed from the information gathering, you will gain complete marks on this domain. Now, another last domain will be applied knowledge part, and I do not have much to say about it. So, interpretation of the clinical findings. Sometimes they will give you findings, and you have to interpretation of that, and you need to explain it to the either examiner or to the role player. Interpretation of investigation. They will give you an investigation, and you have to do the interpretation. That means, if, like for example, some ovarian hyperstimulation stimulation syndrome patient is there, and they have given you this urea and electrolyte or kidney function test report. So you would not say it is sodium is less or potassium is low. So interpretation will be, the investigation shows this patient has hyponatremia or hyperkalemia. So this is the interpretation of the investigation. So this type of this type of knowledge they're looking in the any question? Any question?
Bagi mo nan pwede lang bank check out.
Yes. No, any questions? Okay. So interpretation of the investigation would be like that. You have to explain this is a investigation is showing hyponatremia or hyperkalemia. So this will be the right way to answer or do the interpretation of the investigation. Another will be the well-organized plan. So whatever the management you are doing for the patient or you are doing management role play in the candidate station, you have to come up with the organized plan. Okay. Then management plan. So how will you make the management plan? You would give them options 1, 2, 3, 4, and 5. What are the options are there? You have to explain them option. You have to explain what could be the risk for this and what could be the benefit of that. Then it will be like patient centered and this whatever the options you are giving and what is the management as plan you are giving to the patient, it has to be according to the evidence based guidelines. Either the answer will come from your RCOG guideline or it will come from NICE guidelines. So why the people get less marks in the applied knowledge part, or what are the pitfalls? So actually patchy knowledge these days, as their people they're not giving their exam right now after clearing part 2, and they are or sometime they're not getting place in the exam. So there had been a lack in between part 2 and part 3. So unless candidate keep on revising their guidelines regularly, so some part of their knowledge becomes like faded. So this is a patchy knowledge. So if you're not giving your exam immediately after passing part 2, so to update your knowledge, you need to keep on revising your guideline. At least if you are practicing station, revise that guideline that day only. Another is the scattergun approach. So what is this scattergun approach? Scattergun approach is that, so you have asked history, then after that you have moved to giving management plan to that patient. Again somehow you remembered, oh, I left this in a history, let me ask again. Then after management plan you are again asking history. After history you are again explaining them investigation, or you are again going to the applied explaining them management. So moving from history taking to examination to investigation and applied knowledge. So if you are not following that pattern, if you are just moving here and there, that means you are not organized, and that approach is a scattergun approach. And this part 3 examiners, they don't like this scattergun approach. You have to be very systematic, well organized, well planned whenever you are doing stations. So it has to be in a systematic manner. This is the requirement for part 3 from the candidates. Then not applying relevant portion of the guideline to the task. So if the task has come or if the station has come, only small part of guideline will be tested in that. So you have to apply that part of guideline. Okay. And not sometimes there are certain comorbidities are already associated. If you are doing management to them and you're not understanding what could be the implication of that comorbidities on her condition and the management you are doing, then you won't be able to get marks in the applied knowledge domain. Then not listening to her wish in her care plan, this is again pitfall. So this type of pitfall can there in the applied knowledge part domain. So keep on revising your guideline to avoid this patchy knowledge, to make an organized plan to avoid this scattergun approach. Please find out what part of guideline is important for that station and put that relevant part of the guideline in the station. Then understand if there had been any medical comorbidities associated, and listen to her, what are her wish, what type of treatment she is looking for. What could be the sources for this applied knowledge? We already know these are Green Top guidelines and Royal College. All information leaflets you need to know very well. These are NICE guidelines, and all NICE guideline has got patient information leaflet that you need to know and read very well, because that will help in your station too much. Another, there are some talks, though the knowledge from talk is not that much important, but there are some important talks from recent years that is has to be read before exam, because there some viva stations can or case-based discussion can come from those talks. And sometimes the stations are there and we don't have all leaflets, so you look for NHS site. In NHS site you will get most of the leaflets. Strategy is a whole strategy. It will be like very difficult to read it before the exam, but at the end of every domain, every tutorial, there are certain case studies. They make their station sometime from these case studies, so please read all case studies. And there are CPD case studies also, that can also come as a station. Embrace, reading about embrace is must, because many of the station you will get like some diabetes viva is there, epilepsy patient is there, or if there had been mental health stations are there. In all those stations you have to put your knowledge of embrace as well, so reading of embrace is also must. So these are all about sources of applied knowledge. Anyone has any question about that? Because I'm moving towards station overview. I have already explained about domains. So about all 5 domains explanation, if anyone has got any question, can ask me. Okay, now I'm moving towards stations overview. So this is the for all maximum all of the station, there is a framework of consultation. What is this framework? So first you have to initiate the session, then you need to gather information, then you need to do the physical examination. You have to explain do the explanation of the some investigation, or you have to make the management plan. After that you have to close that station. So this is the framework of consultation, and that this framework you have to maintain in a systematic way in all stations. So now I'll be explaining this framework to you. So what is this framework? So first of all, initiating this session. So in the starting, initiating this session, that means that you have already adequate knowledge from the notes and the referral letter. That means you have already read the information that has been given to you about that station in that standees in your 2 minutes reading task. So this is like gathering information about that patient. Then after now when you move inside, then you have to ask in the information gathering. There are 3 types of question. These are open-ended, probing, and closed question. And what the information gathering domain would require, that you have to use all three type of questions. Open-ended question at least 2 or 3 times has to be used, probing question 1 or 2 times, and closed station will be questions will be you need to use towards the end of information gathering. Now let me explain you about this. What are these open questions? So open-ended questions are the questions they do have some like advantages. So because if you start your station with the open-ended question, so she will tell her story more completely. Rather you asking questions, one question after another question, allow them to speak. So she will tell her story more completely, and she will then choose herself what she want to say and the what way she wants to say it. You will be able to get more illicit information, and also you will be able to explore her idea about her disease. So these are the importance of asking open-ended question. Now let me show you what are the open-ended question. So open-ended question will begin with can you, why, what, and describe. So beginning of the consultation should be started with this open-ended question. So what way you can do? Okay. So I have read the referral letter from your GP, but in your words, can you tell me why are you here today? Or so this is an open-ended question. So if you ask this type of question, so she will be explaining like in one question she'll be able to give you so much of information. So in answer will be like very big, and she'll be explaining everything. Another open ended question, can you tell me, Mrs. Jones, what is troubling you most? So if you ask this type of question, she will just explain everything about her problem. So whenever you are starting the station starting has to be done with an open-ended question. In the middle of your history taking, you have to ask some probing question. That means your probing question will probe into their problem. So what makes your pain better, or what makes it worse? Then, and towards the end of your consultation, like at end of information gathering, you have to ask some closed-ended question. They will begin with when, which, or did you, and answer will be yes or no. Okay, so this type of closed-ended question, they will give you very less information about patient, because answer is only yes or no. This type of questions should be asked towards the end of information gathering domain or history taking. Okay, so your history should contain the blend of open-ended, closed, probing, and the closed questions. And these examiners are, whenever you are framing your questions, they are looking at it that what type of questions you are framing to this patient. Now, so this is about obstetric station. So this is now see these are our COG expectation in obstetric station history. You need to check on age, BMI, gestation, present complaint, history of presenting complaint. Okay, so what is with what complaints they are coming, then history of index pregnancy. If there had been any multipara, then past obstetric history, past medical history, past surgical history, drug history, family history, and social history. So these are the points they are looking in the history, and this is expectation, RCOG expectation in obstetric history taking or obstetric cases information gathering domain. So what I have just designed a template. So everyone has to design their own leaflet and template, so that the same template has to be used whenever you are practicing or you are doing station. So I have just organized in my own way. So present pregnancy, first of all, you have to start your station with a present pregnancy complaints, and you have to gather details of first trimester, second trimester, and third trimester. So this will be about mother, and apart from this, you have to gather some details about the baby. You can so whether she's feeling fetal movements or fetal kicks. And if it is a multi-para patient, then you have to gather information about the past pregnancy details, whether same complaint has been there, what was the mode of delivery, whether there had been any complication, what was the outcome, and if the then you can just to make rapport, you can ask the name of baby or how that baby is doing right now. So you have to take the present past pregnancy details, and some of the stations will be there where they have come as a birth option counseling. So you have to ask very well about present future pregnancy plan, because unless you ask about future pregnancy plan, your counseling will be like deficient. So the mnemonic for this I use for myself is PPF, that is the present pregnancy complaints, past pregnancy details, and future pregnancy details. Okay, so this can be a mnemonic for the obstetric history taking, PPF. After obstetric history, it will be followed by the gynae history. So if you are dealing with the station of early pregnancy module, so you need to ask LMP. And if you are dealing any APH patient, then you need to ask about smear. So this part of gynae history will be required in the obstetric station. Then after this will be followed by medical, whether she's on any current medication, whether she has taken any medication in the past. So this is current medication detail. past medication detail, and whether there had been any allergy. So because allergies must, asking about allergies must in all stations. Then this will be followed by surgical details, family history details, and the social history. In social history, what you need to cover will be like you need to check on smoking, alcohol, drugs, occupation, whether she requires any support, if there had been any safeguarding issue, mental health, and keep on checking. You need to check on BMI. So this is the like template or format from top to bottom. You need to cover in a systematic and well organized manner to take history in the obstetric patient. And I have made 3D for this obstetric history. What you should not forget in obstetric history will be that D1 will be the violence, domestic violence. Checking of domestic violence should be there in obstetric station. Second will be depression. If it is antenatal, then also you need to check on mental health or depression. If it is postnatal, then also you have to check on depression. Third D will be DVT. That VT risk assessment is must in antenatal and the postnatal station. And you have to show your knowledge about checking of these 3Ds. These are like must in the obstetric stations. So this is my the template for obstetric history, and this is my arrangement of the questions, and but everyone makes his or her own template. Now the gynae stations. So this is the expectation of the RCOG in the gynae history. So you need to check on age, presenting complaint, history of presenting complaint, and you here it is a little bit different. Systemic inquiry. So if there had been involvement of any other system, you have to do like systemic inquiry. That is must. Like whenever the gynae stations are there, we always ask about 3 compartments like bowel, bladder, and also we take their sexual history details. And if there is a requirement of doing other system inquiry, that has to be done. After that, it will be past gynae history, past obstetric history, past medical, past surgical history, drug history, whether they have taken any drug in the past. Family, this will be followed by family history and the social history. So this is the RCOG expectation from the gynae history or gynecological history. Now I have put this in my template again. So everyone has to make a very well organized template, because the clinical examiner, they are listening very carefully to you. So it will start with the details of present complaints. So what is her complaint? What are the aggravating factor? What are the relieving factor? And and you need to check on the severity. And what are very important, what is effect of the current problem on their quality of life? Like their quality of life is affected in their work or in their general life or in their home. So this quality, asking impact of this present complaint on the quality of life is really important. After present complaints, it will be past complaints, like same type of problem has been happened in the past and what type of treatment they have taken before. Then this will be further followed by gynae history, as these are gynae stations, so detailed gynae history will be a must. So if you are getting a patient that is of like reproductive age group, you need to check on complete menstrual history, like number of days of bleeding, the regularity of cycle, any associated pain. You need to check on LMP to rule out whether they are already pregnant or not. This is must. Then if she is more than 25 years of age, then you need to check on a smear. Again, you need to ask about contraception. And if you are dealing up like patient, she's already postmenopausal age, then in gynae details, you have to check on details of their menopausal symptoms. Okay. And then the gynae, now this is all gynae is done. So present complaints, past complaint, then complete detailed gynae history. This would be followed by the obstetric history. So that will further detail what type of details are required will vary from station to station. For example, in prolapse station, And in stress incontinence station, in prolapse station, asking about number of deliveries, birth weight of the babies, and weight of the babies will be important. In stress incontinence, if there had been any difficult delivery, that would be important. So obstetric history, what is requirement of each station will depend on the that type of station. But after this gynae part has been done, it will be same. So it will be medical history, whether she is currently taking any medication, and be very clear, because if they say they are taking any medication, please ask whether they are herbal or non-herbal medication, because many times they are taking non-herbal medication. Then you need to check on whether any past medication has been done. Checking allergies must everywhere in all station. This would be followed by surgical history, family history of the same problem, and the social history. Social history will be same, asking about smoking, alcohol, drug, occupation, support. And in some of the station, you need to check on mental health. BMI you have to do in every station, because this will change many things in your applied knowledge part or management plan. In all gynae stations, a differential diagnosis making has to be always keep in mind, because if you are dealing only with the one type of, if you know already that you are dealing with the if there had been bleeding in early pregnancy station is there, or if then you can't do that only as a miscarriage. You have to make differential diagnosis. For example, differential diagnosis will be miscarriage. Differential diagnosis can be this ectopic pregnancy. It could be mole. So whenever you are doing history taking, you have to just rule out all differential diagnosis. So this is about if the bleeding in early pregnancy has come, and like if in gynae patient has come, this patient has this premenstrual syndrome, and it is quite clear from your station that has been given to you, then also you need to just keep at least one or two differential diagnosis. Like you can keep this PMS plus endometriosis in your differential diagnosis. And when you are gathering information, you need to just rule out them from taking your history, because all this part these are what type of differential diagnosis you are making and how you are reaching to your diagnosis of your station. It will be seen by the clinical examiner very well. So please make differential diagnosis. After this information gathering part, it will history taking part will be examination. Whenever you need to do any examination, please explain. Please bring the chaperone in the station. So this is a part. This is requirement of the patient safety. Whenever you are doing any examination, just put them in three categories. It will be general, abdominal, pelvic. If it is role player examination, explain them what you want to examine and why. And if it is a clinical examiner station, then also you have to explain that why you want to do that examination. Because in part 3 examination, whatever you are doing, any investigation, then you need to keep on justifying. That means you need to keep on giving answer to everything that what you are doing. Okay, so this is requirement of RCOG again. So whenever you are arranging an investigation, please justify. If you want to check for hematocrit in the case, for example, in the cases of OHSS, please explain that you want to see hemoconcentration, therefore you are doing. So this is explaining investigation and just giving them justification why you want to do that. Unless you are doing your justification, you won't be able to get marks in the exam. Okay, only just arranging investigation carries no marks, then not overdoing it. So whenever, because NHS is provides free medical services to all, so whenever you are arranging for any investigation, you have to justify it. You should not overdo it. You should not unnecessarily put a patient at the risk of radiation. That means you won't be offering unnecessary investigations, x-rays, and interpretation of result has to be there. That will come in the examiner stations. So this is about investigation. After that, making shared management. So this will come in the applied knowledge. You have to make shared decision after giving her all options. Now, last part in the here I am explaining you this framework I have explained before. Okay, I was explaining you this framework. So I've explained you initiation of the session, gathering information, physical examination, explaining and making management part. So last part will be closing of the session. So closing of the session. So towards the end, like minute of your station will be closing of your session. So what you have to do in that, you have to summarize it. So whatever consultation you have done, you need to summarize that. You need to recreate that plan, and also you need to make it sure that the patient has understood that plan of care, and she's agreeing to that plan, and she should be given ample opportunity to raise her concern. So this will be like closing of the station. So in all stations, you will be just doing the station according to this framework. So what is framework? It will be initiating a session and gathering information, then doing examination, arranging for investigation, making a management plan, and closing the session. So all this framework has to be maintained in all stations. Towards the end, you have to give a written information, that is leaflet, and that is must. That is a requirement of RCOG. And what the mnemonic, this I gathered from strategy. So your consultation are the best. So when you are beginning it, you have to begin with the non-verbal clues. So what are these non-verbal clues? So these are you have to be enter in the station with a smile, with open. You welcome the patient with open arm. You need to lean forward, and either some of the stations, if you wish, then you can do handshake, and you keep on just whenever you are make eye contact with them, and nod them. So for everything they are saying, you can just nod your chin, or you can just say yes. That means you are listening them actively. So this is B, that is beginning with the non-verbal cues. Then E will be the establishing information gathering, and with the informal talk. So it will be like very informal, not anything official about it. S will be supporting them with the emotional channels. So all type, you need to find out what type of support requires in the station, and you have to terminate the station with a positive note. So this you have to follow from top to bottom in all stations. So towards the end of consultation, so this can be, so your patient should be completely satisfied. They should go back home with a clear management plan, and they should be given complete information. And also so they should be given safety netting advice when they have to come back with the follow-up appointment, and also with the communication details, that where they will contact whenever they have any problem. So this is the ending of the consultation. Then now if anyone has got any question can ask me, otherwise I'll be just moving towards the tips of station. Anyone has got any question, or should I continue? Any question? No question. So these are the small some tips I have just gathered. I would like to share with you. So again, this is the steps of station. Uh, Again says this is the same explanation of framework of consultation. First, your station, when you enter inside, it will start with introduction, your name, your role, your place, what place you are, labor room, whether you are in a labor room, antenatal clinic, fertility clinic, and urogynec clinic, where are you? then what shift you are working, morning shift or night shift, and it will start with a confirmation of identity confirmation of the patient name and age. So this will involve, this will come introduction. So when you enter, you have to introduce and put all this thing in the introduction. This will be then followed by agenda making. That means you have to make an agenda of your consultation, what you are going to do in her station, in that station, and keep on checking patient concerns, patient ideas or expectations. So this is like must in every station. After agenda, you need to gather information, that is history taking. After history taking, you need to examine that patient or do some investigation. Then this will be followed by the applied knowledge, and this will be followed by the closing of station with a clear action plan. So these are the step of station that will put complete consultation framework in your station. So in this part 3 exam, they are looking for such a well organized and planned approach to a station, not a scattergun approach. Now, another very important thing is the good planning. So as I already told you that before you enter inside the station, you will get 2 minutes outside the cubicle, and in that 2 minutes you have to read that station, and after reading that station you have to make your plan. In the exam they will give you a small rough copy and also the pencil. So with every station you will get 2 minutes and that paper and pen. So you have to make your 2 minute key, and this 2 minute key, well planned 2 minute key, is the only thing that can give you success inside the cubicle. Because if you are well planned, you have made your good planning that what you are going to do in the station in 10 minutes, that will give you a pass mark. So what I used to, this has been designed by me, what I used to do for myself. And you need to just write name of the patient, age of the patient, BMI of the patient. So these 3 things are must, because this will be identity confirmation, and BMI is must in all stations. Then you have to, from outside only, you will make and you will gather an idea with what type of consultation you are going to do. Is this a happy consultation or a sad station will be like breaking bad news station. So accordingly you have to plan outside. If you are just giving that pregnancy test has become positive and they are planning for pregnancy, so these are the happy stations. You can enter in the station with a smile and you can say them congratulations. But if it is a breaking bad news station is there, in that situation, that stations are like sad station. So you have to enter in the station with like either some sort of sadness or like mask face or serious face. That way you have to enter in the station. Then always, so this you will find out what the expression, what is the requirement of that expression inside the station. Then you need to keep on making diagram. Making diagram is must. Whenever you start making diagram in explanation of the any condition to the patient, then immediately you will find that lay examiner start giving you marks. Then you have, from outside, when you are standing outside, you have to find out what type of task has to be done. So it will be history. Please clearly see whether they require detailed history or it is a focused history. If the detailed history is required, then you have to ask, you have to follow your template from top to bottom. But if it is focused, then some part of the history will be missed, because you have to take history that is relevant to that index case. Then please see whether, if you have to explain investigation, that means there would be some blood tests or there would be some scan reports that you have to explain. Unless you have explained that those investigation, you won't be gathering mark. Then answer, another they will write answer her concern. That means your task, she's sitting with some concerns, and you have to ask and you have to answer them. then only you will get marks. So and management plan. So what type of management that is required for that particular station that you have to make. So this task, what type of task they are looking for you to just to in that station, that you have to do your task, because you will be getting your marks according to the task you do. Domain, again, I have explained that before also. This is domain, this exam is testing knowledge on the basis of domain. Please, whenever you are standing outside, please see what type of domain are tested. So information gathering domain will never be missed. Applied knowledge part will never be missed. And this communication with patient and family and patient safety, these domains you will always do in the station. But important domain that missed is the communication with colleague. So please specifically look for it. If it is there, then please write down on all communications and put them in the station. So these are and you need to clearly find out what is your position, whether you are consultant or you are ST5, whether you are doing morning shift or night shift, which place of clinic you are. So all this you have to do right in your 2-minute key. So if you are made excellent to 2-minute key, then you will be and you are well planned, then nobody can stop you from doing well or passing that station. So this is format that had been made by myself for me. You people can add or delete or make your format, but this is must. And one important tip, when you are moving from one station to another station, please turn the page of that booklet has been given to you. Otherwise, in that stress of the exam, there could be possibility that you have moved to station number 3 and you have not turned your page, and you will keep doing you will keep repeating the name of the patient or role player that you see in the previous station. So please, once you move to another station, please turn the page, because this mistake is very common and in the stress of exam. So whenever you are moving to station, turn page. Now the role. So now some important tips. So so in the role player station, these stations are very, very important station, because you are getting 2 examiners and maximum number of domains tested. These are 7. So 4 domain will be tested by your clinical examiner. 2 or 3 domain will be tested by your lay examiner. So this station, they carry 14 marks in total. Okay, so do all role player station very, very, very well, because they carry maximum marks. And in the role player stations, so there's some tips for that. You need to keep on making eye contact. Eye contact, that means whenever you are doing in station, so it should be complete eye contact, and so that it will appear that you are just like involved in the station. Then this is the first part, is eye contact, that is must in role player station. Second is the active listening. I will explain you what is active listening. And showing your empathy. Like showing your empathy is very important, and I will be explaining you that also. And offering them support. So these are the keys or clues or tricks for the role player station, that you need to make eye contact, you need to do active listening, show your empathy, and offer them support. Now I'll be explaining them one by one. So eye contact, I have already told you. So you should not just break eye contact in the role player station. So this is the picture that shows eye contact. Then active listening. So what is active listening? So you have to build in the active listening, you need to build rapport with the patient. You need to ask specific questions, and you need to just demonstrate their concern, and you use some brief verbal affirmations like I can see, I see. Okay, so this type of thing will be required in the active listening. And what are the principle of active listening? That you should start with the open-ended question. You have to be attentive, that you are listening to that role player very carefully. Whatever she's saying or whatever questions she's asking, you are very attentive. And you need to, like, once the history has been you have already history has been taken, so towards the end you can just summarize that. Okay, so Mrs. Like John, what I understand that you have come with this problem, you have taken this treatment, and this is your problem, and I'm going to do this. So keep on summarizing. So the summarize towards the end of the history you can summarize, or when, if you have got time and you have done the management plan, then again you can summarize. But this last part becomes difficult to summarize, because you will, your bell rings before you do that. And paraphrase, like you need to keep on reflecting the what the patient is saying. Like if the patient is saying thing, either you can nod or you can just say yes. So this is again shows that you are doing active listening. Whatever the feeling they are showing, so you have to reflect on their feeling. So if the doctor, if she's saying, okay, that time was very difficult for me, so you have to reflect her according to her feeling. Okay, I understand that that time must be very difficult for you, Mrs. Smith. How did you cope up at that time? So this is again reflection of their feeling, and just asking them probing question, what make this pain better or what make this pain worse. So these are the principle of active listening, and you really need to actively listen um, to this patient, to the role player, because you can't just ask anything again and again, because that will carry bad impact on your answer, your getting your answers. Another important, so role player station after eye contact and active listening, it is showing empathy. So what is empathy? So empathy is putting yourself in her shoes. That means what she's feeling, you are feeling in the same way. So this is the empathy slide. So I know exactly how you feel. So many stations will be like empathy stations. They are checking on your empathy only. So whenever you do practice, gradually you will find out that in what station you would require to show your empathy, and what dialogues you will be using to show empathy. So this is all also very important in the role player station. And another part, so this is again showing this, I have put this picture to show what is empathy. So that means you are connected with your role player. So this is empathy, that you are putting yourself in her problem. So what will be the situation if you had same problem? So this is empathy. Okay, this is empathy connection. But doing it here, reading it here, seeing this picture is easy, but to do in the station, and what type of phrases to be used, where the empathy has to be put, is like slightly different, but with the gradual practice, it comes in the station. Another, like this, in what way you can show your empathy? If the role player is in pain, you can offer her pain relief. If the role player is like vomiting, you can offer her vomiting medication. So these are like, if the signs of pain are there, so these are the key moments that you can tune in with the patient. You can make connection with this patient, gather information, and offer them support. So this is recognizing their suffering is a just showing your empathy, because empathy is a skill and you need to learn that to pass this exam. So this will be the one way you can show your empathy. Another way, that you can ask some question like, what's the most important thing that we can do for you today? So like you are connecting to her, so what is the important thing for you? Please tell me, I will do that for you. So, and then listen to their complete answer. That will give you complete understanding of the patient. What is the requirement of this patient and what is the need? That is another way of showing empathy. And then share decision making, like offer patient options, describing their risk benefit, and ask for their preferences. So if you're doing like this way, asking for their preferences, their views, then this will be their keeping it, their beliefs in the picture. So this will come again the empathy showing. So there are so many ways in the exam you can show your empathy. So with a gradual practice, you will find that where you have to show that what are the areas of the station that requires your empathy, because again empathy is a skill. Then support, there will be some role player stations where you would require to offer them support. If some teenager girl is coming, if it is she's a single mother caring for two children, if there had been any smoking in the stations, alcohol, if the role player is doing, if she's a drug abuser, if there had been any element of domestic violence, if she's a like old age woman, sometime you will find that old age woman, she's living alone and she has come for some treatment. So, and some safeguarding issues are there. Either it is a adult or safeguarding, or it is a child safeguarding. So these are the these are the station you need to offer them support. So whenever you do a station, you will able to find that these are the, okay, these patients are having this problem, let me offer support to them. So these are the like clues for the role player station. Let me summarize this. You need to just make good eye contact. You need to do active listening. You need to show your empathy and offer them support. So these are the like tricks to gain marks in the role player station. Now the tricks for case-based discussion station. So in case-based discussion station, these are the Viva stations, and you only 3 to 4 domains are tested here. So they carry less marks. They're not checking on your communication. They are checking on your knowledge. These are the knowledge stations. So whenever you are going inside the station, and you need to start by saying, okay, hello, my name is this, and this is my candidate number. After that, you need to just sit down after doing just making this introduction. Then whatever the type of station is there, you need to start with the importance of topic. Like for, I can give you one example. If the station, this case-based discussion is about collapse, so before examiner starts you asking question, just tell importance of that topic. I understand that like what way you will show importance. I understand that this is this Mrs. Smith, she has collapse syndrome number 6. So ideally, collapse being this collapse is an obstetric emergency. If prompt identification and prompt management is taken, then that will reduce on the patient's mortality and morbidity. So just give the 2 or 3 lines, just explain what is the importance of that station in the that topic in the case-based discussion. So that will be like very good start. Then the important trick in case-based discussion station is listen to question carefully. So this is the maximum candidate make this mistake. So they, in spite of listening the questions completely, they keep on answering, and they then they answer according to their wish, whatever they want to say. But in that in that situation, they won't be gaining marks, because you have to understand the question, you have to listen the question, and after that you have to answer that carefully. Like, many times the most of the common mistake in case-based discussion, usually 3-4 questions are there. So when the first question is started, so the candidates start speaking on the first question. Many times it had happened. So they have spoke so much that all 4 answer that was a requirement of that station, they have answered in first question only. To avoid such type of situations, please listen to questions of examiner very, very carefully. These are the trick. Now again, how to prepare. Ideally, you should have 2 study partners, because these days it is not always a possibility that you and your study partner will get a place in the exam. So ideally make 2. And whenever you are doing station, do, then please keep this time so that you have an idea that what you can do in 10 minutes. Always ask feedback according to the domains and from your study partner. History has to be done in 4 minutes because many times people do mistake. They keep on taking history for a very long time. From now, you can do 4 to 5 stations daily, but 1 month before exam, you need to do practice at least 8 to 10 stations. One online course is must because that give you detailed feedback. Because in on spot courses, the feedback time is only 2 minutes, and what 2 minutes are very less to explain that what wrong has been done in the station. So one online course should be done for detailed feedback, and one on spot station course should be done ideally before the exam to just feel that stress of exam. So how it goes when you have to do 14 stations one after another in a row. So you need to feel that pressure one time before exam. Ideally, it is preferable to do an RCOG course because there is like a complete simulation of the exam. But RCOG courses you can do at the UK, London, or there are also there in another places also like Singapore, Malaysia, Delhi. They do also have RCOG courses. So if you get an opportunity, please do that, because if you're not going to UK, you are going, if you are able to do RCOG course in any other place, so it will be like same, because all course material, it comes from UK only for RCOG courses. But if you're not able to book that, then do any circuit course for the revision so that you have that feel of exam. So another key to success is to find a good study partner who can give you good constructive feedback, because that will improve your performance. And just last slide for today. On the day of exam, stop studying evening before the exam, sleep well before, have a very good breakfast, avoid too much coffee and tea, because you 2 hours and 46 minutes this exam goes and you can't really use washrooms, and you need to dress very well, look very smart for the special big day. Please don't stress your mind, don't study in the morning, don't forget to take your candidate number and your passport to show your identity, and be calm and confident. You may find some stations you know nothing about them. There could be a possibility, though it is very rare because all of candidates they prepare very well. But if some you are finding some station that you have not read at all, so please identify what module they are testing and start doing that station. At least if you are not able to get mark in applied knowledge domain, you will get mark in the information gathering domain, and also you will get mark in the communication with colleague, or you will get mark with the communication with patient. So if you are not, if you don't know any station, so it is at least a marking is according to domain. You don't know, that means you don't know the applied knowledge part. So rest, please be very calm, confident, and go do that station. At least you will get mark in all three domain except this applied knowledge, because RCOG can ask anything. All the best, and from Mission MRCOG. From my side, I would like to see you in your picture in this photo frame. And thank you for attending this. For any query, you can just click this missionmrcog.com. So for any query, you can send it to me. And thank you all for being with me. If any one of you have got any question, can ask me. Otherwise, I will be closing. Any questions? Any questions, friends? Okay, so again, I will thank you all for on the behalf of Mission MRCOG. for attending this session. And I'm recording this. I'll be putting this in the group. And if you have ever have any question, you can just ask me in the group. I'll be there always to help you. Thank you.